I'm Melissa Nossick. I am the Chief Executive Officer at the Competency and Credentialing Institute, and I'm really happy to be here today to share a little bit of information with you about our TrueNorth Award. So to start off, just some objectives for the presentation is that we're going to review the components and the scoring of the TrueNorth application. We're going to provide an overview of the award, the application, and the evaluation processes that we use when scoring applications. We also are going to discuss some common questions related to completing an application throughout the presentation. So just to share our mission and vision statements, CCI promotes certifications and continuous professional development, which drives safe, quality patient care. Our vision is growing a community of lifelong learners for whom CCI is a catalyst and integral partner. I mention this because the real spirit of the TrueNorth Award is that it goes to a facility that really help promote the mission and vision of CCI. Just to cover the DEI statement, CCI leadership, management, and governing bodies jointly support the fair treatment and dignity of all human beings. This certifying organization does not discriminate against its stakeholders, including applicants, certificates, volunteers, or employees as to age, sex, race, religion, national origin, ethnicity, disability, marital status, sexual orientation, gender identity, gender expression, or any other basis prohibited by law. And so just some housekeeping items to get us started. Today's webinar is being recorded and will be available on the TrueNorth tab of the CCI website soon. And questions will be answered at the end of the webinar. So as an overview, the TrueNorth Award was developed to recognize facilities that use certification as a true north, or for guiding the perioperative nursing staff to be lifelong learners, models of competent practice and advocates for excellence and patient safety. Facilities who earn the TrueNorth Award exhibit the highest standards in perioperative certification excellence. Certification in many ways acts as a compass, directing a nurse's clinical practice towards nationally accepted standards, and it allows them to demonstrate their mastery of knowledge. Registered nurses who hold CCI's credential, as well as facilities that support those nurses' certification goals, demonstrate their commitment to improving patient outcomes. So, eligibility for the TrueNorth Award. Healthcare organizations that employ any CNOR, CSSM, CNAMB, CFPM, CNSCP, or NPDABC certified nurses, or have certified nurses as members and or representatives, are eligible to apply for this award. Organizations include, but are not limited to, hospitals, health systems, surgical services departments, ambulatory surgery centers, a unit or division of a larger organization, or self-nominations are also accepted. Organizations that employ any member of our CCI Board of Directors or CCI staff are ineligible to apply. We do that just to make sure there's no bias in the application process, and that the application process can be truly unbiased and towards anybody that applies. So for selection, an independent selection committee appointed by the president of CCI Board of Directors will choose the award recipient. So there's a whole committee of our board members that are put in a position so that they participate in the process for selecting the TrueNorth Awards recipient each year. It is a lengthy process. All awards are conferred at the sole discretion of CCI, and CCI reserves the right to substitute awards. Award recipients waive all possible legal claims against CCI arising from the selection of award recipients and the use or receipt of the award. All nominations, including all supporting materials, shall become property of CCI. So some of the components of this award are a commemorative recognition plaque, an on-site presentation of the award by CCI and a member of the CCI Board of Directors. Most often, the president of our Board of Directors and I travel to the facility and present the award to the facility that achieves this honor. We also give a $1,500 contribution for a celebratory reception to be held in conjunction with the award presentation. A lot of times facilities spend some of that money, that $1,500, for the award reception, but then they save some of the money for awarding their staff in various ways at later times. We also offer free professional development activities for staff as a part of receiving this award. Obviously, a TrueNorth hospital or facility that receives this award have a lot of professionals that hold CCI certifications. And because we offer professional development activities, we will work with the facility to see what activities will best serve the nurses that work at their hospital. And then in addition, CCI has some communication initiatives, including a press release, which announces the TrueNorth Award winner. So in addition, there are some new pre-screening questions that we're going to be using this year. The first of those is, does your facility offer financial support for certification? And the second one is, do at least 70% of the nurses in your facility that are eligible hold a CCI certification? These two pre-screening questions are important because the application process for TrueNorth is quite extensive. And by asking these questions up front, it allows you to identify whether you might qualify for the TrueNorth award. These two questions were actually common characteristics of hospitals and facilities that have received this award in the past. So this should give you a pretty good indication of whether you're going to be a competitive applicant for the TrueNorth Award. The evaluation criteria are, so organizations will be evaluated on specific criteria, which are divided into categories. The criteria demonstrate how an organization advances the cause of perioperative specialty nursing certification. And the recipient of this award will have demonstrated a consistent history of implementing activities that encourage, support, and reward professional perioperative registered nurses in achieving CNOR, CSSM, CNAMB, CFPN, CNSCP, or NPDA-BC certification. Some important dates to remember are coming up soon. August 1st, 2023, that's when online applications open for the TrueNorth Award. November 30th, 2023 is when applications close and submissions are due by 11:59 p.m. on November 30th. In the first quarter of 2024, we will notify the winner of the TrueNorth Award, and non-winners will also be notified at that time. So the date range for all of the questions that you answer as part of the application process is January 1st, 2021 through November 30th, 2023. So any activities that you describe as part of the application that you are using as justification for why your facility should receive the award, those activities should fall between those dates. And you'll see me reference those dates throughout this presentation. And so just keep in mind that those dates are important because that's when it's a period of almost 3 years that you have to indicate which activities make you a qualified candidate for the TrueNorth Award. The application materials. So each of the application materials are in different categories. So the first categories is the 5 elements of nursing specialty certification excellence. And in this category, you'll be asked to provide description and documentation of evidence about how each element is demonstrated. In category 2, you have certification ratios. So this is a numerical value that is a reflection of the number of full-time employees that are perioperative nurses who are eligible to be certified in comparison to the number of full-time employees who are certified. So you're going to be giving a ratio, and that's where that 70% qualifying question comes into play, because we have found that TrueNorth recipients have at least 70% of their hospital staff who are eligible actually certified. In category 3, we have documentation of leadership support. So we ask you to provide letters from your CNO, CEO, or COO, actually. So if you don't have a certified nursing operation or a CNO available, you can use a chief executive officer or a chief operating officer. And then you also have to have the director of surgical services provide a letter of support as well. And in those letters, it describes the facility supports for certification. In category 4, this is the narrative category, and this has the impact of certification. So this is a narrative describing and documenting accomplishments and achievements to include the citation of specific examples. This is worth a total of 100 points. So you'll see that points are given for the various aspects of the application process. And as a reminder, again, you have about a 3-year period where those activities could have occurred, and that's from January 2021 through November 30th, 2023. Okay, these are the 5 elements of the nursing specialty certification excellence. This is the category that's worth 30 points. And element 1 is structure. The focus in structure is on facility support for nurses in their certification journey. Element 2 is recognition, and the focus here is acknowledgement and support of certified employees at the facility. Element 3 is professional engagement, and its focus is on the promotion of internal professional development activities. Element 4 is dissemination. So dissemination focuses on the outreach and dissemination activities beyond the facility. And element 5 is volunteer service. Volunteer service is the participation in volunteer service in the community and beyond. Now I'm going to elaborate a little bit more on each of these. So for structure, acknowledgement and support of certified employees. Some examples in this category are reimbursement for prep courses or exam fees, bonus pay or salary raises for certification, that the employer provides CE, continuing education, for recertification, that preceptors must be certified, facility host certification study groups, or there's maybe a lending library. And in this category, there's a 500-word limit. So when you're submitting your narratives for each of these categories, just make sure you could open a new Word document and type your narrative in there just to make sure that you don't exceed the 500-word limit in your submission. Element 2 is recognition. Recognition is the acknowledgement and support of certified employees. And some examples in this category are wall plaques for certified nurses, newsletters celebrating certified nurses, facility-sponsored meals or snacks, certification day celebrations, and certification rates that are publicized. Again, a 500-word limit here. Element 3 is professional engagement. So a focus on the promotion of internal professional development activities. Some examples of this are a certification coach in residence, a Take 2 program at the facility, a TrueNorth application previously submitted, staff teaching at colleges or trade schools in the area, and utilization of the CFPN, and that's the foundational credential that individuals get before moving on to CNOR. Again, there's a 500-word limit for element 3 as well. Element 4 is dissemination. So outreach and dissemination activities beyond your facility. Some examples in this category are reimbursement available for attendance at professional meetings, research activity, professional publications, and presentations at professional meetings. For element 5, which is volunteer service, this is participation in volunteer service in the community and beyond. And some of the examples here are test development, volunteer service with the local AORN chapter, community service, mission trips. Again, a 500-word limit here. Next, let's take a look at certification ratios a little bit more closely. So the factors to consider here in your calculation is the total number of full-time employees of perioperative nursing staff who hold CNOR, CSSM, CNAMB, CNSCP, CFPN, or NPDABC. And then B is the total number of full-time employees of perioperative nursing staff who are eligible to be certified. This actually can be a pretty easy calculation because essentially all perioperative RNs who have completed orientation should be included in this number. And that makes the calculation pretty easy. It's A over B times 100, and then you get your percentage certified. As a note, the CNOR, CSSM, CNAMB, CNSCP, CFPN, and NPDABC credentials may all be used in this calculation. And for the record, that is all of the credentials that CCI offers, and you can find that easily on our webpage. Okay, documentation of leadership support. So the components here, as I mentioned before, are a letter from the chief nursing officer, the chief operating officer, or the chief executive officer. And so you're going to have two letters, one from any of those people, and the second, a letter from manager or director of surgical services. The documentation should include evidence of support of certification, inclusion of specific examples of that support, paying close attention to grammar, spelling, or punctuation errors, and a signature on each of those letters. All activities and accomplishments, again, remember, they have to have occurred from January 2021 to November of 2023. So whoever is responsible for writing your letter, make sure that they have those parameters of the kinds of documentation they should include and the time period for which those activities had to be included. So after you receive the letters and before you submit them to us, make sure you do your own review of those letters to make sure that whoever wrote the letter followed those parameters, and to make sure that that letter will count for your organization. Now, the narrative on the impact of certification. The intent of this section is to answer the question, how are certified nurses applying their knowledge and expertise to affect positive change in the patient and nursing outcomes? The emphasis for this section should be on the so what of your certification efforts. This description should address the process, implementation methods, and results achieved from the work of the certified nurses. And the emphasis should be also on measurable outcomes. Trends and comparisons to internal and external benchmarks will also help to substantiate achievements. And scoring in this area is 20 points for focus on documentation and citation of specific examples, 20 points for the impact of accomplishments and achievements, and 10 points for the quality of writing. So make sure that you're reviewing your narratives and paying attention to all of those items. Here are some examples. So for the impact of certification. So examples of certified nurses' involvement with policy development, education, and integration with staff. Results of employee engagement surveys and the relationship to certification. Documentation about how certified nurses share information to improve process and how the cycle of learning spirals upward in a positive way. Description about how certified nurses are involved with interdisciplinary collaboration. Examples of certified nurses participating in facility or system level committees. And it's not just participation, but what has been accomplished that should be documented. Again, paying close attention to the timeline. And in this case, there's a 1,500 word limit on the narrative. So steps in the application process. Make sure you review the application instructions and the scoring rubrics in the TrueNorth section of the CCI website. It is quite an involved application because it is a really prestigious honor for a facility to receive this award. Make sure you do the pre-screening questions first to make sure that you'll be a competitive applicant as well. Gather letters of support from your CNO, CEO, or COO, and the director or manager of surgical services. Complete the online application via the TrueNorth section of the CCI website under the About Us section at the bottom of the homepage. Write the narrative in a separate document to ensure adherence to word count, spelling, grammar, etc. Copy and paste the information into the application. Bullet points can also be used to reduce the word count if you're having trouble getting everything you want to say into 500 words. And that's the end of this presentation about the TrueNorth Award. I also want to mention that our TrueNorth liaison at CCI is Morgan Halverson. She will be happy to answer any questions that you have about the application process. And her email is also listed here as mhalverson@cc-institute.org. Thank you so much for your time.